RSV is a virus that affects the respiratory tract. It can cause pretty big problems in children and older individuals. The signs and symptoms of RSV can present somewhat like a common cold. You can get fevers, runny nose, cough, those kinds of things, but you can have more serious symptoms. It include shortness of breath, having low oxygen, turning blue, those kinds of things. You can get very severe coughing in young children that can interfere with their airway and things like that. Younger children are much more at risk of RSV because their immune systems are still developing. If you haven't been exposed to RSV yet, you don't have the immunity built up. So younger children can be much more at risk. And then older individuals also have waning immune systems, and they can be at higher risk for the disease as well. In eastern North Carolina, we're seeing pretty significant increases in RSV. The season started a little bit earlier this year than we're used to seeing, and we're continuing to see upward trends. The most important way to prevent spreading RSV is to wash your hands. It does contaminate surfaces, so wanting to make sure you keep your hands clean, trying not to touch your face, especially if you're around small children who can carry the virus. Influenza is a virus that affects the respiratory tract. Signs and symptoms could include fever, chills, muscle aches, nausea, vomiting. What's unique about this flu season is that it started much earlier than we're used to. We actually had somewhat of a break from flu over the past couple of years while COVID was really taking off. We hadn't seen much influenza, but we are starting to see significant increases at this time. And throughout the state and the country, we're seeing similar trends. Preventing influenza, primary things to do is staying away from others when you're sick. It can be spread through coughs, sneezes. You want to make sure you're washing your hands. Wearing a mask can also be effective for preventing influenza as well. The influenza vaccine is also something important you can do to protect yourself from the virus. It's recommended that you get it every year, and we do try to formulate the vaccines to protect specifically against the strains we think are going to be circulating. We're currently going into respiratory season, seeing a lot of increases in not just COVID, but influenza and RSV. Going into this holiday season, I know we tend to gather in big groups, but if we're not feeling well, it's important to try to stay away from others to prevent spreading the disease, especially those that can be more vulnerable, such as young children and older adults.